Good morning, everyone. Welcome you all. I hope you are all at home and staying safe and trying to uh, follow the social distancing as much as possible. Today, we are going to discuss about the COVID-19 situation in Mizoram. And the aim is to understand what all each states, each of the departments are trying to do in this very, very challenging times. How are they trying to help the citizens? How are they still running their day-to-day operations in their offices, in their departments? And we have with us our eminent speaker, Dr. C Vanlalramsanga ji. Welcome. He is the Secretary, Department of Urban Development and Poverty Alleviation, Government of Mizoram. Welcome, sir. Thanks for joining us here.
Thank you very much, Ravi.
Thank you.
Thanks for having me here.
Thank you. The pleasure is ours. And we have our audience who are joining us on Zoom here live, and we are also live on our Facebook channel of eGov Magazine, our Smart City handle on Facebook, and also on our eHealth Magazine handle, and also on our Banking and Finance Magazine handles. So there are a lot of diverse set of viewers who are watching this live. I welcome them all here. And to start with, what I'm going to ask our eminent speaker is that what is the situation of the COVID-19 in the state of Mizoram, and what are all the cases right now, and what all the precautionary measures being undertaken by the government to stop any spread of the disease in the state. So,
thank you very much, Dr. Ravi. Thank you very much for having me here, and good morning, everyone. And I also want to thank Elets for having interest on how we fight COVID here in the extreme corner of our country, the northeast in Mizoram. So far, Mizoram has been very fortunate to have only one positive case with a travel history from Europe, Amsterdam, in March 24th. The patient has actually returned to our states on 16th of March, diagnosed in 24th, but now he was actually cured and released from the hospital. Right now, Mizoram is free of COVID-19. But government is taking all necessary measures to ensure safety of human lives while taking appropriate measures to mitigate the economic and business impact of the pandemic in the state economy. And as in other states, our students and migrant workers in other states are actually coming back, and also people have started coming back from foreign countries. So we expect around 15,000 people to return back home. So exodus is already started. So we are taking all precautionary measures. We believe that the unity and cooperation among all concerned, including the government, the NGOs, the public at large, and individual citizens, displayed during this ongoing pandemic crisis has been instrumental in curbing the spread of COVID-19 in Mizoram so far. So there's a very, very unique case in Mizoram. Let me start with the timeline of how we actually fight and prepare for this pandemic. We all know that India reported its first COVID-19 positive case on 13th of January. My government, Mizoram government, has already done statewide public appeal on 27th January 2020. Even before the nationwide initiative is visibly seen, our state government is quite active in trying to mitigate this COVID-19 pandemic in Mizoram. On the same day of 30th January, when India has reported its first positive case imported from outside, Health Minister has actually called a meeting, and we formed a state-level task force to deal with COVID-related crisis regarding preventive measures, primary health care, and screening of people coming from outside. So, state-level task force is already in place on 30th January 2020. All action plan to mitigate COVID in the state has put in place, and starting from 4th February 2020, in 4th February 2020, even at the country level, we are not doing any screening at the border and airports. But in Mizoram, on 4th February, we have already started screening of people coming from Myanmar and Bangladesh borders. So screening has already been started on 4th February. And from 6th February, the government has actually put in place a screening of all passengers coming in by road from interstate, Tripura, Manipur, and Assam, and also in the airport. So screening, complete screening of people coming from outside is already being done starting from 6th February 2020. The timeline is quite actually advanced as compared to the national timeline. And
if I like interrupt you here, that how
yes,
like how come you were doing all this in like so much advance when the other states were not doing this like anyway? So what prompted you to do this advance action?
Actually, one issue is that we are bordering two countries, Myanmar and Bangladesh. So our border is quite porous, and also our leaders are quite active, quite educated, and they know they can quickly assess the threat posed by this pandemic. So they decided very well in advance that we should take all precautionary measures that we should at the time when the first positive cases reported in India. So that can be attributed to our strategic locations, something which is actually quite sensitive in the sense that it can come from any corners. And also the second thing is I think governance level is quite active here, and they're well educated, and they know the threat very well in advance. And also people are participating in all the kind of support that they can give. So they're quite supportive. So there's a mix of all kind of good people here in the state.
Great.
And
Very interesting.
you may like to actually also note that home quarantine of people coming from outside, particularly from foreign countries, affected countries like China, Europe, and US, has already started in 6th February 2020.
Wow.
At that time, in the national news, people coming back from Europe and people coming back from China are roaming freely. But here in our state, they've been actually compelled to home quarantine starting 6th February 2020. So it is actually quite advanced. Our first patient who has come back from Amsterdam on 16th of March was actually home quarantine. And because of that strict and precautionary measures taken by the government and himself, he did not infect anybody. He lived in his home with his family, home quarantine, but nobody got infected. And he was actually admitted to a COVID-dedicated hospital in Mizoram Medical College on 24th March. But he has not actually infected anybody there in the hospital also. So, yeah, very fortunately, he got cleared and already released from the hospital. And, in 27 March, PPE and other medical kits were. So we feel that we should actually take airlift protective equipments from other part of India. And Mizoram is, I think, one of the first state to get PPE airlifted in a dedicated aircraft.
Oh,
It came in the national news also. So we
Okay.
take all these precautions. And yet another one that I would like to say is that before the national lockdown on the 22nd of March, Mizoram has already declared complete lockdown on 20th of March.
Wow. Okay.
So when national lockdown is actually announced for 21 days, ours is already 23 days because
Okay.
it's continuing.
Okay.
So even before national lockdown, we have already got this kind of arrangement in the state government. Another one, let me come to the topic now, community participation.
Yes. Yes.
You know, in Mizoram, we have, like I said, on 30th January, we have a state-level task force for mitigation of COVID-19 to coordinate all works in the state. Another layer is district-level task force. State-level task force is actually under the chairmanship of Chief Secretary. And under the state-level task force, we have so many task group, 9 task group and 2 committees. They're all coordinating the statewide efforts on mitigation of COVID. Not only that state level, we have 3-tier system of COVID containment task forces. State level is one at the apex. Second level is district level task force under the chairmanship of each of the deputy commissioners in the district. And they are coordinating mitigation work in district level. And one of the most important one, which is actually absent in all other states, is local level or village level task force. In the city and town, in each of the locality, we have a task force. And in all villages, we have a task force chaired by local council chairman. Local council is like a panchayat in the panchayat system, gram panchayat level. So in villages, village council chairman, and it includes all NGOs and government officials. So they all work together at the local level and village levels, and they are taking care of all sort of supply chain, and also they are actually doing strict vigilance on social distancing, compulsory wearing of masks, and opening of shops, and also vegetable supply chains, meat supply chains, etc., etc. So basically, 3-tier system of COVID containment task forces is actually based on community participation. Everybody, even at the level of the village and the locality, are actually involved in our fights against COVID-19 in the state. So they have actually a standard operating procedure for a local level or village level task force, or actually prepared by disaster management departments. Based on that SOP, standard operating procedure, they are actually doing their works voluntarily at the local and village level. That makes all the works actually smooth and also participative. If everybody participated, and actually the level of compliance, you can't actually imagine this. It's quite good, and no major violation of lockdowns, no major violation of curfews is seen in the state. So everybody, almost everybody, is quite disciplined in the state. That's how we fight our COVID here. I think there is a small video prepared by one firm, one private firm. It may be interesting to see by our audience. If you permit, then we can see that video.
Yes.
It's a video of about 2-3 minutes only.
Yeah. Sure.
Thriving in the northeast of India, this is Mizoram, the land of the Mizo people. Since the onset of coronavirus pandemic, Mizoram had recorded 1 positive patient. Following the safety measures and restrictions put forth by the government, NGOs and local task force, the obedience and discipline maintained by the Mizo community is remarkably outstanding. On 15th March 2020, the state government announced to observe 14 days of home quarantine for people coming home from outside the state. By then, most of the NGOs, sports councils and churches had already taken initiatives by calling off all social gatherings, sports events and church services. On 22nd March, a day after the Janata curfew was observed, the state declared a lockdown. Mizoram is one among the few that do not require external forces or any kind of lathi charge to maintain discipline. Under the state task force, a voluntary local task force had been formed through the village and local council along with the various NGOs. The local task force took initiative in maintaining the lockdown, all the while catering to the essential requirements of the people in their respective localities. The local community, local NGOs and churches donated a generous sum of money to the Chief Minister's Relief Fund and also to their respective local task force. Home-tailored PPE had been contributed by various tailors across the land to meet the shortage of supply for the medical workers and the local task force on duty. Adding to that, public footpaths and railings had been disinfected by the local communities at their own interest. Shops and essential commodity supplies are controlled by the local task force when and where deemed necessary, wherein the people maintain social distance in their queue. On such occasions, people maintain discipline and refrain from unnecessary hoardings. For essential groceries, the local task force collected fresh vegetables in a bulk and distributed them from house to house at a lower rate, or in some cases, free of cost. The distribution of food is further extended towards non-Mizo workers, truck drivers and laborers who are stranded in Mizoram during the lockdown. To ensure the safety of the public, the Mizoram police had been camping out at the borderline since the lockdown. The real unsung heroes are the Mizoram police, doctors and nurses who are the frontline warriors of the coronavirus pandemic. Since Mizoram is predominantly a Christian community, the people hold a peaceful anchor in their Christian faith. This may be one of the reasons why the community experiences unity in their discipline and their motive to help one another in times of crisis. This is further strengthened by the Home Crusade held through live television and YouTube broadcasts. Amidst the looming COVID-19, the nights in the Mizo Hills are often filled with echoes of people's worship, prayers, and singing, a comforting calm amidst the unprecedented storm. Lockdown does not prevent its people from observing Palm Sunday. The people adjusted to their balconies and rooftops to participate in the solemn function. Yes, the fight against COVID-19 is an ongoing process. The future remains uncertain. But here in Mizoram, everyone takes up the battle. And as long as we're in it together, we hope that someday we shall overcome. Until then, stay safe, stay at home. This is RJBD from Radio Gapshop 94.3 FM on behalf of Inkel.com, reporting from Aizawl.
Very interesting, very interesting. That specific line about there was no lathi charge, like in see no all forces around the country. Yeah, it's forced upon people that you have to be inside.
Yeah. Everybody is actually fighting for one purpose, a common enemy, not fighting each other.
So
that's how it works.
So how did you did the government build an awareness that it's a problem of everyone, not only the government's problem?
Yeah. Like I said earlier, on 27th of January, public appeal has already been made, and that continues even till now. Public awareness and appeal to observe all sort of social distancing, etc., etc.
And please talk about, explain about the preparations you did from the angle of health facilities, because in the case of an unprecedented situation, if the numbers would have risen, so
yes.
Yeah, so preparations.
Health facilities are actually not really very good here because maybe because of our locations as well. We don't have a super specialty kind of health, but we have a very strong and solid primary healthcare system. I think that makes all the people easily aware the threats of COVID-19 even early on. And that helps people aware and actually do some sort of preventive measures. The only preventive measures that we can do is social distancing, etc., etc. So people observe very well, even at the very extreme corner of villages in the state. And we have a dedicated hospital, Mizoram Medical College Hospital for COVID. And we, in the government, arrange all the district headquarters, district hospitals, to set aside ICU and dedicated isolation beds in each district. So a set of hospitals declared as COVID dedicated hospital and isolation beds. And quick assessment of all private and public health facilities was done. And based on that, we actually assess some sort of gaps that we may have based on possible outbreak in the nation and also in the state. So we have actually made proposals to various funding agencies for strengthening of health infrastructure in the state government. So the continuing work is there. All help coming from various sources, including from a private firms and companies, and also from Ministry of Health and Ministry of Donor, and also Northeastern Council. So there's an ongoing work. I don't know how long this the virus will impact the nation, but we are actually taking all precautions and prepared for a possible outbreak here. And I think this will be an ongoing work for the whole year, most probably.
So, yeah, sure. Please.
One thing that I would like to share with you is, for example, the PPE. Yes. There's huge shortage of PPE everywhere in the country, particularly in the early 21st day lockdown period. So our startups, our tailors, our designers are actually come out very, very strongly to fill this gap. And we have people volunteering to prepare PPE, masks, sanitizer, disinfectants, PPE, full set, gowns, shoes, etc. So we in the state has around 300 different groups who are actually preparing this PPE to fill the gap. And as of now, I think around 20% of the local demand was actually met from the volunteers who come in response to this market failure regarding supply of PPP. And some of them are actually registered themselves afresh. They're shifting their domain. People who are earlier into food business are actually shifting into production of PPE after COVID-19 crisis, and also take this market failure challenge and also solve community problem in some line of PPP. I think in my quick assessment, almost 20% of the local demand was actually met from the local production of PPE here.
Excellent.
And they are actually starting off as a volunteer. They are giving it free of cost. Even till now, people are doing it free of cost, but a lot of them are also taking it up into business by shifting from food industry. So it's quite a good number of people are responding to this challenge.
So which means that the local entrepreneurs have
risen. Startups are actually responding strongly.
Yes.
Yeah.
And you are heading the urban development department there. So if you can
Yes.
talk about this in this COVID-19 situation, there is a big focus on sanitation,
Yes.
Swachh Bharat. So if you
Yeah.
can highlight that, what were the steps taken in that regard?
Yes. Yeah, I would be happy to do that because in Mizoram, I can speak of what we do and how we handle this COVID in urban areas, because when COVID crisis was actually more or less felt in our state and also in the country, there is a standard operating procedure issued by a Ministry of Health and Family Welfare regarding handling of solid waste management, including municipal waste. So using that SOP, we actually arranged some sort of an action plan for first, safety of sanitation worker. Second, safety of waste contamination. Third, safety of people in home quarantine, because a lot of people are home quarantine. In Mizoram, we have a unique case of having community quarantine facility, because churches and NGOs are volunteering their premises to be used as community quarantine facilities. For example, hundreds of churches are actually using their halls, Sunday schools, and church facilities for community quarantine facilities. Collecting all this waste are also quite a challenge, and also people are home quarantine. So we have SOP. So with the full PPE, people are collecting this. Our sanitary workers, our frontline workers are collecting from home and community quarantine center, and also government quarantine facilities, and take it into a solid waste management center. And in solid waste management center also we have a separate SOP treating and disposing of municipal waste. We have a very short video of about 2 minutes. If you allow,
Yes.
we can look at how we handle solid waste management here in Aizawl city.
Yes. Deepak, can we have the video, please?
Solid waste management in Aizawl amidst COVID-19. The current pandemic of the novel coronavirus COVID-19 brings serious challenges regarding municipal waste management practices and procedures. The UN Environment Programme urged governments to treat waste management as an urgent and essential public service in order to minimize possible secondary impacts upon health and the environment. The protection of waste management workers and the containment of the COVID-19 spread are our highest priority. As such, the Urban Development and Poverty Alleviation Department, Government of Mizoram, renders an all-out effort to ensure the safety of the community and our frontline sanitation workers. In Aizawl city, the capital of Mizoram, waste collection and transportation is the responsibility of Aizawl Municipal Corporation. After careful inspection, the segregated waste from each household and localities are collected and transported to the Aizawl Solid Waste Management Center to be further treated and managed by the State Investment Program Management and Implementation Unit, SIPMU. The collected wastes brought to the center are thoroughly checked at the gate to see the degree of segregation. Those vehicles which are carrying properly segregated wastes are allowed in the center. All the vehicles carrying wastes have to pass through a weighbridge for monitoring the quantity of waste brought to the center. The dry wastes which are brought to the Resource Recovery Center are first treated with disinfectant and then left for a period of 3 to 5 days to ensure inactivation of pathogens before secondary segregation by the sanitary workers, who are protected with full personal protective equipments, PPE. The recyclable wastes are then ready for sale so as to convert waste into wealth. The wet wastes are also disinfected and then left for a period of 3 to 5 days before processing segregation of non-biodegradable materials which may be present in the wet waste. The compostable wastes are then loaded to the mechanical compost plant for manure production. The health and well-being of our sanitary workers is our top priority. The workers at the center are well informed and are given thorough training for their safety and hygiene. Even before the COVID-19 pandemic, it was a normal practice for the workers to use masks and gloves. They are also instructed to take bath 3 times a day, especially prior to leaving the center. They are also instructed to maintain personal hygiene. Separate bathrooms are provided for men and women. Smoking is strictly prohibited within the center. After the COVID-19 pandemic, additional care has been taken by disinfecting the waste and mandatory wearing of personal protective equipments for the workers. As necessary precautions and measures are taken with regards to their safety, it is overwhelming to mention that the sanitary workers continue to work wholeheartedly amidst the COVID-19 pandemic crisis. Solid Waste Management Rule 2016 demands every generator to segregate their wastes into dry waste, wet waste, plastic waste and e-waste. Let us continue to be good citizens and support our frontline sanitary workers by properly segregating our waste to ensure our safety, the safety of our frontline workers and the environment.
Fantastic. Great to see that so much focus on waste management, solid waste management, and also on sanitation. I also want to ask you about the how has the state government used IT in these situations?
Yes, yes. Thank you very much. Actually, we have the COVID mobile application, COVID-19, where all other IT related applications are actually integrated, like MPass and Arogya Setu apps also. So these COVID-19 for actually monitoring all kind of passes required during lockdown. For example, smooth flow of commodities, smooth flow of some sort of non-essential commodities, but required for moving the economic activity forwards in the state, and also people who needs to come in and go out from the state during this lockdown. All sort of things are actually done through online, so we don't actually need to interact personally. So this COVID-19 Mizoram mobile application is helping us monitor all sort of helpline requirement, quarantine monitoring, and also passes required for this, and also information dissemination through local task forces, and also spreading awareness among the communities are all actually monitored through these mobile apps. So IT applications are effectively used in monitoring and creating a sort of war room, online war room for measures, and also for enforcing lockdown and curfews.
Sure. Fantastic. And if I ask you that because of the lockdown, we are seeing across the country that there is a reduction in economic activity, major economic activity has stopped. So
Yes.
It has reduced employment, and it is
Yes.
hurting the businesses also big time. So how are you, how do you assess the situation in your state, and what is the government thinking of path to economic recovery and job creation?
Yes. Actually, the first 23 days lockdown, in our case it's 23 days, but in the case of national, it is actually 21 days. So the first 23 days is quite severe. We take all precautions regarding this lockdown, and also we take that seriously. It's almost a complete lockdown except for essential commodities. So a lot of economic activities has been actually halted, and the gross state value added loss only because of the 23 days lockdown was actually calculated to be a little more than 81 crore. And for the continuous 43 lockdown, the loss is actually estimated to be quite high. That is why we developed some sort of standard operating procedures for opening up of economic activity we call it non-pharmaceutical interventions. We have an ordinance made which actually ban compulsory wearing of masks in all public places, compulsory wearing of masks, and prohibition of speaking in all public places, and also compulsory social distancing in all public places. So with non-pharmaceutical intervention and the standard operating procedures for doing economic activities in the state, I think economic activity is starting quite well. And that's how we also exit slowly, staggered exit from this lockdown. So slowly, economic activities are actually coming back. So we hope that without so much continuing of lockdown, we'll be able to cope with it. And also one activities which is very, very important is sowing season. Sowing season is in, and we appeal to people to do it more than previously. And our horticulture department, agriculture department are building a very good seed banks. And in some cases, they are actually distributing at free of cost. And they go around and look at the field and potential of that field the farmers owing. So they're trying to optimize the land for all agriculture and horticulture purposes, particularly on food sectors. So I think that will help in coping with this pandemic in the near future.
And your Department of Urban Development would have prepared a roadmap for the year before the COVID situation came in.
Yes.
And
Yes.
has there been any changes in the whole plan of the year after the COVID situation?
Well, in Mizoram, urban development poverty alleviation looks after 5 flagship programs of the central government. So far, we haven't seen any visible change in the scope and also guidelines of all these 5 flagship programs. As far as the state government is concerned, we are taking precautions, and most of our urban infrastructure investment will focus on job creations, while also addressing infrastructure deficits in urban sectors. But as far as possible, our minor and major works in urban development initiatives will focus on, as far as possible, job creation, and also something that will generate future income.
So there are a few questions on the screen. If you can open the Q&A button, so we can there is a question regarding the what is the connectivity situation in Mizoram? How are you able to reach out to the far-flung areas? This is the second question I'm actually taking it. And secondly, how is the state dealing with the cross-border movement across its porous border? And I think the similar question is the first one, that how are you managing the infection control at the international borders?
Yes.
Yeah.
Like I said earlier, since 6 February, all the people coming in from borders of Myanmar, Bangladesh, and interstate border from Manipur, Tripura, and Assam were actually screened. Screening was started on 6 February. And when the situation has actually intensified, we closed all international borders. We close all international borders. Even till now, we close all international borders. We open up only international interstate borders of Manipur, Tripura, and Assam. The main line of our supply chain is through Assam and through train up to Bhairabi. So when the situation intensified again, and it's been a bit difficult to contain border entry and exit. We close Manipur interstate borders and also Tripura interstate borders, opening up only Assam border to train and road. And also we close down our airports slightly earlier than all airline was closed. So we close a little bit ahead of the national close down again in our airports. So right now, the only true commodity supply chain corridor open for the state is in the state border of Assam in two places only, Bairabi and Vairengte, and also train through Bairabi. So these are the two lines. So it's actually easier for us to monitor if we open less.
Okay, fantastic. That I'm happy to see that that you are looking at the movement at the borders, and that is critical for this handling this situation of COVID-19.
Yes.
So hats off to your state for making that happen. Because if we don't do that, we'll be in a soup, I suppose.
Yes.
Yeah.
It's quite porous actually. There's so many entries. As of now, we have around 150 duty posts in the international borders, manned by Assam Rifles, BSF, our local police, and local level task forces. So altogether, it is around 223 duty posts, only international borders. So international borders and interstate borders, around 223. So it's quite porous and also quite sensitive. If we open only a few, who is actually considered to be a lifeline for supplying of commodities, then it's much easier to handle for us.
There is a question which is, although not related to your department, but I think this is a interesting question, and you may look at it, that how are you managing the education scenario of schools, especially the higher grades like 9th and 10th class during this COVID-19?
Education institution was actually closed starting COVID lockdown announced by the national level authority. It was remained closed, but most of the institutions are quite innovative in taking up online mode. They are doing online mode. Actually, there is a TV program on lectures. For example, is actually local channels and also DDK. Our education department is actually running some sort of lecture series for different classes in DDK and local channels. And a lot of people are actually resorting to online mode assignment through online and submission and test through online, and also lecturing through online. But the difficulty is actually faced in rural areas, remote areas where you don't have a good internet connectivity. And also you don't have that much of scale who will be using that online facility. There are hardly hundreds students in one institutions, and it's a bit difficult to organize some sort of resorting to online mode. So as far as possible, particularly in city and town areas, they are doing it quite effectively.
So I want to ask you that as this COVID numbers are still increasing all over the country, migration of workers is happening, and it may increase again the numbers across the country. So how are you seeing the next 3 months, 6 months, or a year? And what is the new way of working, new way of living, new way of working in the government, working in the private sector, going to schools, going to offices? What is that new normal everyone is talking about in the COVID-19 situation?
Yes, I think we more or less need to learn with the new normal, which is that we have to live with it, but taking all precautionary measures. For example, like I said, economic activity has been opening up in the state with non-pharmaceutical intervention, with a very strong standard operating procedures to follow, backed by law, because compulsory wearing of masks, compulsory observance of social distancing, and also washing of hands, and also no spitting in public places, etc. These are quite important. I think in Mizoram also, what we do was that people coming in has been screened and all precaution has been given. Screening here doesn't only mean temperature screening or symptom screening, but here what we do is that people coming from outside are all run through the test, that is rapid testing kit RATI. They went to, and if the RATI is positive, they were observed in the hospital, and a PCR test was run. Only if they have confirmed negative, they can go back to community quarantine center, government quarantine facility, or home quarantine. So all precautionary measures was actually done because as far as Mizoram is concerned, the state is free of COVID as of now. The spread will come only from outside. So all precautions has been taken for the people coming in from outside the state. So that's what we do. And inside the state also, backed by law, public gathering is actually not allowed, and all compulsory sort of measures was actually done, and night curfew is still effective. And people who are actually in economic activities are encouraged through observing NPI's standard operating procedures to do their respective work flawlessly. And I think that will become a new normal for a long time.
Yes, yes. That living with Corona is the new normal. No. We have to live with the fear, with the precautions and all the safety measures. Another important question which I want to ask you, that the central government has announced a series of measures to help the industries, help the MSME startups. So are there any steps being taken by the state government to help the startups and the small organizations, because they are the most affected by this situation?
Yeah, we are actually examining the details. Details is yet to be seen. So there's a information block announcement made by the central government. We wholeheartedly welcome all the announcement made by the central government. We'll very sure try to take full advantage of all these measures. In Mizoram also we try to prepare. We had actually 2-3 series of meetings already in preparation to the central announcement. But since the details is not yet available with us, we are actually closely working with the central government to take full advantage of all these announcements.
And you have been our speaker at a conference we have organized together, and we have worked with each other for a magazine, of special issue of Ego magazine, and also we are here. And the Elets has been trying to bridge the distance between the government and the citizens by spreading like ideas on innovations which are being done by the government. So do you have any suggestions for our work at Elets and our team, that how we can do more things, better things?
I think Elets is doing very well, and one of the best platform to share our views and works together. And I have seen that Elets has already organized a huge series of webinars in all sort of, not only restricting to one issue, but also very comprehensive issues from all states. You know, I would really like Elets to continue this trend, and also thank Elets profoundly in what they've been doing and providing platform for sharing of actions taken by various departments, various states, and also central government. It's been very useful and very resourceful. We can learn from each other, and we know what other people are doing through Elets. And I think this is excellent job done by Elets. And one thing that I think we can do is that, for example, PM has announced the recovery package. A sector-wise deliberation platform, I think, can be provided by Elets, involving the ministries, officials, and the state line departments, and also people who will be actually benefiting, like entrepreneurs and industry, etc. For example, one suggestion that I would like to make: the logistics. There are a lot of suggestions coming that logistics is a main supply chain disruptive component. And the way to handle logistics at this time of pandemic and this kind of crisis is using some sort of blockchain, where people, suppliers, producers, customers know exactly what sort of logistic and supply chain position in a transparent and visible manners. Visibility of logistic and supply chain is very important and critical, particularly people living in the far-flung areas like Northeast, South End, and North End, etc. So I think one platform that Elets can work on with industries, governments, and consumers is to develop or initiate a discussion for developing a blockchain to look at the supply chain management in the whole country perspective, or maybe a regional perspective. I think that will be very useful for all of us.
Yes, I think it's a very important point you raised about the logistics, which has been hurt badly because of this situation of Corona. And I think each state is facing its own challenges in the logistic arena. So we can deliberate on that and bring the industry stakeholders and talk about the situation. So with this, I think we have we are nearly at the end of this webinar. But before we leave here, I want to ask you one thing: that how is the difference? What is the difference between the impact of Corona in the Northeast and the other states? Like, how is it different or similar?
I think the difference right now is that Northeast has huge international borders to look at, and also the cost of guarding these borders, whether there is a risk, huge risk or no risk, we have to guard it. So that's quite different, and the costs and the community participation, particularly in Mizoram, is quite impressive, and I think that will actually make us busy in the times to come. Also, that is our unique case. The second thing is logistical problem. You know, like we said, logistics. We have one railway line up to Bairabi in Mizoram. In Northeast, a lot of hill areas where train do not actually reach there. So the logistic issue was very much there. And also when this rainy season comes in, our road sectors are quite sensitive again, because of the possibility of landslide, road blockage, etc. So that could actually disrupt our supply chain here. That's another thing. The third thing is that even though super specialty hospitals and specialty hospitals are largely absent in Northeast, but primary health has been taken care of much better than the I think than most part of the country. I think that is why COVID spread has been more or less easily or more at ease contained in Northeast. The spread is actually not as fast as in other states, because primary healthcare and community mobilization and also proactive governance is quite easy as compared to other states. So community are actually responding in a very positive way. Community participation is very critical, and primary healthcare is doing a very good job, solid job in spreading awareness and mobilizing people. I think that is a unique case of Northeast, which it may not be seen in other places, because in Northeast, even though COVID was present early on, but the spread is contained more or less much easier than other places in the country.
So I think the audience would have realized that this Mizoram model of handling the COVID-19 situation is very unique. They have almost 0 cases till date, which is a feat in itself. In spite of having the international borders and various borders with other states, they've been able to contain that. And in fact, I came to know today that the state of Mizoram had implemented the various measures for screening much before the other states in the country had done.
Much.
So I think, and the community participation model, the primary health focus, that primary health is sector is very strong, and I think the people participation, people involvement is so strong. This is a great case study, and I think several states of the country can learn from this exemplary success of the Mizoram state in combating the COVID-19 situation. Hats off to you for great work, and you and your team and all other officials of the government who are handling this situation so well. And we hope and pray that the situation keeps like this, and does not other numbers going to increase in your state. So with this, we thank you, Dr. Vanlalramsanga ji.
Thank you.
All the audience who are joined here, and I request all the audience who are watching this video on the Facebook, that if you have liked the Mizoram model of combating the COVID-19 situation, please like and share this video on Facebook and YouTube, so that this whole idea of people participation, community participation for handling disasters and pandemic reaches to a lot more people all over India and outside India also. So namaskar, and thank you so much.
Thank you very much, Ravi. Thank you.
Thank you so much.